Hello, I'm Bo Biggs and this is Kim Jernigan. We're the co-chairs for the Pensacola 2017 Mission of Mercy event. Welcome to Pensacola. Thank you for volunteering.
This is the signature event for the Florida Dental Association Foundation, and we are so excited to have you take part in this event. We plan to treat 2,000 patients in our community, and we'll do that because you're going to come and help us, and we're going to restore dignity and alleviate pain for many of the citizens of our community. Thank you for planning to be with us March 24th and 25th in Pensacola, Florida.
Plan to have a great time. It'll be a very rewarding time providing care for those in need, but I guarantee you will also have fun.
Go team!
Go!
Hello, I'm Chris Bolness, Co-Clinical Director of the Pensacola Moms event. I'd like to thank you for volunteering, and I'd like to go over some important information. I'm in charge of the pre-treatment areas, and would like to go over the manner in which we have it set up. Before the event, you will receive different protocols that are specific to where you volunteered. Please familiarize yourself with these and the site plan so you'll know where you are going and what you are doing. The pre-clinic will be outside and in Building 3 and consists of the following areas: patient education, patient registration, medical triage, radiology, dental triage, and routing. The clinical lead for each section should have previously sent you the appropriate information for your section, along with other important information that you should know before arriving. After you have checked in at volunteer registration, picked up your shirt and name tag, you will then proceed to Building 3. Find your area and check in with your clinical lead, who will be there. He or she will go over the pertinent information with you in respect to your department. Your lead is there to assist you, guide you, and try to make the event as pleasurable and rewarding as for you as possible. That being said, please do follow your clinic lead's instructions. A lot of time and hard work went into them to make this a safe, productive, and rewarding event for you and others. Thank you.
Hello, my name is Steve Christ, and I'm going to walk you through the dental triage protocol. An oral examination is going to be performed by the dentist. The dentist will indicate in blue ink the patient's first and second priority. It is important for the dentist to explain to the patient that the first priority may not be able to be done. If so, they'll move to the second priority. In addition, inform the patient that if he or she wishes, they can return outside and go through the waiting line once again to receive treatment. Generally, a priority is defined as work that can be done in one quadrant, whether it's fillings or extractions, and within one treatment department. However, in some cases, if time permits, it may be appropriate to do multiple teeth throughout the maxilla. The work should generally be able to be completed in a 45-minute time frame, excluding numbing time. This time may be adjusted depending on the patient volume. The need for pre-medication is determined in the medical triage department based on the pre-medication protocol and will be dispensed in the medical triage. Patients who have received pre-med will be wearing a red and white striped band. In the event of an adult or child, age 11 to 17, both require treatment. An adult pedo black wristband will be placed on the adult to alert departments that the adult requires treatment, which requires sequence coordination with that of their child. The dentist doing the dental triage will place a wristband corresponding to the patient's first priority from the possible choices. If pre-med is required, they get a red and white stripe band. Hygiene and cleanings, they get a pink band. Restorative /fillings, they get a green band. Lab/prosthodontics, they get a white wristband with black letters. Pedo/kids get an orange wristband. Adult pedo, black for adult needing treatment with child needing treatment. Root canals/endo get a navy blue band, and companions get a light gray band. Now, use only blue pens on the charts. Please print all information and do not use abbreviations. Ask the patients what their main problem or discomfort area is. This is going to be the top priority in making the primary diagnosis and will be our #1 priority in treatment. Pain abatement is always the top priority. Afterwards, we can denote the second priority, such as decay or a filling required in an adjacent tooth in the same quadrant. Chart the exam by indicating the work that is recommended to be done in the priority of treatment sections on the patient registration form. Again, a priority is defined as a tooth or two adjacent teeth that need similar or accomplishable treatment. We provide black and white dentistry. Leave the gray for another day. If a patient does not wish to have certain recommended treatment, indicate by writing "patient does not want" by the recommended treatment. Circle the tooth numbers in red within the priority that needs attention first. Depending on the number of patients, treatment will initially be limited to one quadrant, identifying teeth accordingly. Refer to other department protocols as needed to make sure the treatment is available. Teeth to be extracted include visibly non-restorable teeth, painful, percussion-sensitive, or infected teeth do not fit the FLAMOM criteria for endodontic treatment, and third molars only if visible on clinical examination and symptomatic, carious, or causing acute pain. Limited endo treatment will be available. Endo will be considered based on the following: anterior tooth with sound coronal structure and easily restorable. No posterior teeth. Anterior tooth exposed during excavation and meeting the above criteria. PA of tooth confirms that endo can be completed. Patients routed to endo, restorative, or oral surgery will receive a periapical x-ray only as needed. You can also request one if it aids in diagnosis. The tooth area in which an x-ray is being requested is to be written clearly in the notes section of the patient registration form. Print the triage doctor's name on the form. When the exam is complete, a patient escort will accompany the patient with their form to the routing station. When triage is completed for the day, dentists can move to the clinic floor to relieve others. Patients are not to walk unattended on the clinic floor. Use your station cards for moving patients or for problems. Everyone should be aware of the cards at the stations. Green means bring me a patient. Red means take the patient to exit interview. Orange means translator. Purple means x-ray needed. White with red, EMT needed. Thank you very much, and we really appreciate your time and talents during these great 2 days. Thank you.